Hi everyone. In this video, we are going to learn about the 10 rights for safe drug administration. I am Jenlyn Bernard, working as tutor in College of Nursing. In this video, we are going to learn about what is medication, its purposes, and the 10 rights for drug administration. A drug or medicine is any chemical substance that causes a change in an organism's physiology or psychology when it is consumed. The medicines are having several purposes. Mainly it is classified under 4 categories. Number 1, prophylactic purpose. There are several vaccines are available. When the individual is consuming the vaccine, they are developing the immunity against the particular disease. For an example, BCG, typhoid vaccine, hepatitis B vaccine. Number 2, it is also used for the diagnostic purpose. Certain drugs or chemicals are used to diagnose the illnesses of the patients. Number 3, therapeutic purpose. There are different drugs are available to treat the medical conditions or to suppress the symptoms. We can say so many examples like antibiotics, antihypertensive drugs, anti-diabetic drugs, antipyretics, analgesics, like that. It is helping to treat the illness of the patient. Then number 4, restorative purpose, like vitamins and supplements. It is helping to restore the body function. In a particular medical ward, there were several patients were getting treatment. One day, in a busy morning hour, all the staff nurses was busy in doing their assigned activity. One of the senior staff, along with a junior, she started serving the medication. She asked her junior to administer injection insulin for a particular patient. She also got it done. After a few minutes, the patient who received the injection got giddiness and fainted. Immediately, the vital parameters was monitored and the doctor was informed. Upon the investigation, they found the patient is severely hypoglycemic. Then immediate treatment was done to the patient and his health was restored. What happened in this incident? There are 2 patients with a similar name. So the nurse missed to check the right patient and the medication was wrongly administered to the patient who is not diabetic. Okay, so it is very important that when we are administering the medication, certain principles has to be followed. To ensure the patient's safety, we all need to follow the 10 rights of drug administration. It is divided into 2 categories, that is basic 5 rights and additional 5 rights. The basic 5 rights are right patient, right drug, right time, right dose and right route. The additional 5 rights are right documentation, right assessment, right evaluation, right patient education and right to refuse. The first one is right drug administration. To ensure that we are administering the right drug to the patient, we need to check 3 times before we are administering it to our patients. First time, when we are taking the medication from the cupboard or medication cart. Second time, during the preparation of the medicine. It is highly necessary to check the name of the drug, expiry date, any changes in the color or consistency of the medication and also to check any damages over the package. Then the third time, we need to check while replacing the medicine, but make sure that it is before administration to the patient. The second one is right patient. To make sure that we are administering the medication to the right patient, we have to ask the patient to tell their name. Don't call the patient by their name, because sometimes when they are in pain or other discomfort, they may not be listened properly. Just like that, they will be responding to us. To avoid this error, we have to ask them to tell their name. Then the second identification, check the ID band for the right name. If we are using the computerized medication administration system, the barcode scanners can be used to read the name of the patient. Then we have to ensure that we are using the correct case sheet for that patient. That is, we have to check the name in the case sheet also. Third one is right time. The time of administration will be mentioned in the medication administration record. Still, certain medications has to be administered before food. Few diabetic medication, proton pump inhibitor, preferably the antiemetics can be given in the empty stomach. Most of the drugs will be administered after the food. Then the antibiotics. Antibiotics has to be given in the prescribed time schedule. If we are not administering on the appropriate time interval, it may be facilitating the microbe to develop the resistance against the particular antibiotic. And also the time of administration is highly important. It is based on the action of the drug. For an example, if we are administering the diuretics, we know that after taking the medicine, the patient will be passing urine several times. If we are giving it in the night time or evening hours, it will be disturbing the patient's sleep. Other than the emergency or stat orders, preferably the diuretics has to be administered in the morning hours. Likewise, the sleeping medications like sedatives, it has to be preferably administered before bedtime, so that the patient will be able to sleep during the night time, and daytime they will be active. And medications like laxatives, preferably it has to be given during the bedtime, so it will be having adequate time to work on the body, so the patient can able to pass stools in the morning hours. Like that, every medicine according to the timing which is preferable for the patient functioning, it has to be administered. The fourth one is right dosage. To calculate the right dose, we can use the formula, that is desired amount divided by dose on hand multiplied with the volume will be the required dosage which we need to administer to our patient. And always the nurse has to be knowledgeable regarding the calculations and the unit conversions. It is highly needed to prevent the medication errors. When we are administering the liquid medication, the appropriate device has to be used to measure the medication to avoid the errors. Always we have to use the medication cups or medication fillers to calculate the right drug. And also the liquid medication has to be measured at the eye level to prevent the errors in finding the reading. Only in the home measurements, when it is unavoidable, we can ask the patient to use the teaspoons to measure the liquid medication. But nowadays almost all the medicines are coming with a measuring cup, so we have to teach the patient how to measure the medicine in the medication cup. And to administer the injections, we have to use the appropriate size of the syringe. When we need to administer the smaller amount of medication, we have to use the smaller size of the syringe, that is 1 ml or 2 ml according to the measurement. But when we are using the larger syringes for the small quantity of medication, very easily it will be leading for the medication error. While administering the medicine, always try to use the specific dosage preparations or the unit dose system, because it is highly helpful to prevent the medication errors. Don't ever try to cut the medicine with a pill cutter or breaking into 2 or 4 pieces, because it will be giving uneven pieces, so that we cannot able to administer the right dose of the medication to our patients. The fifth one is right route of administration. According to the route, the onset of action will be getting varied. The intravenous injections will be start acting within 30 to 60 seconds. Likewise, oral medication, it may take 1 hour or even 1.5 hours. Like that, according to the route, the onset of action also will be getting varied. And not only with that, there are different routes of administration. According to the preparation or the form of the medicine also will be getting varied. So if we are taking a particular medicine like paracetamol, it may be available in the syrup form, it will be available in the tablet form, and also it is available in the injection form. So we need to follow the doctor's instruction to administer the medication through the right route. The basic 5 rights are highly important or highly necessary to prevent the medication errors. Number 1, right patient. Number 2, right medication. Number 3, right time. Number 4, right dosage. And the fifth one is right route of drug administration. This we can remember very easily by asking the 5 questions. What we are going to administer, that is medication or drug. So the first right is right drug. For whom we are going to administer, to the patient. So number 2 is the right patient. When we are going to administer, in the right time. So number 3 is right time. Then how much we are going to administer, that is right dosage. And how we are going to administer, the fifth one is the right route. So 5 basic rights are highly necessary to prevent the medication errors. The sixth one is right documentation. Don't ever leave the medication at the patient's side and don't tell them, okay, take your medicine after some time or after having your food. Because when we leave it like that, the patient may forget to take the medicine, or it may be misplaced, then totally they will be forgetting to consume the medication. Always make sure the patient has taken the medicine, or if it is injection, after administering injection only we need to document the procedure into the patient case sheet. While documenting the medication in the case sheet, make sure the following informations were documented in the medication record, that is the patient name, drug name, what we have administered, and also the date and time of administration, the dosage of administration, and also the route has to be clearly documented in the patient case sheet. Documentation can be done in the medication administration record or into the electronic device, that is according to the hospital policy. When we are documenting in the computer, it is highly facilitating to avoid the medication error, because while we are scanning with the barcoder, if the medicine is not on the right time to administer, it will be warning the staff who is going to administer. So most of the drug administration errors can be avoided while we are using the computerized medication administration system. The seventh one is right assessment. Before administering the medication, we have to assess the patient and we have to come to the conclusion what is the need for administering this medicine. Especially when we are giving the PRN and SOS orders, many times the patient may not require for it, but still we may be administering. For an example, when patient is getting admitted with a complaint of fever, the initial days patient will be having the fever, so we may be administered in the TDS order. But after that it may be changed TDS PRN. That is when necessary only we have to administer. But most of the time without assessing the patient may be receiving the medication. That has to be avoided. Also, when we are administering the medications for the long term purpose like antihypertensive drug, we need to monitor the blood pressure. When we are administering certain cardiac drugs like digoxin, we have to monitor the pulse rate. Sometimes the blood parameters may need to monitor like electrolytes and also the blood glucose level. According to the action of the drug, we need to assess the patient before we are administering the medication. The eighth one is right evaluation. Once the drug is administered, we need to check for the therapeutic effect, whether the purpose has been achieved or not, whether the body temperature has come down, the vomiting came under control, whether the patient is free from pain. It has to be evaluated and it should be documented in the patient case sheet. Also, when patient is getting treatment for the chronic illness, periodically the needed investigations has to be checked and it has to be monitored whether the medicine is giving the desirable effect. The ninth one is right patient education. When we are administering the medication to the patient, we have to explain to them about the action, side effect, physiological effect and the psychological effect, because certain medications may make color changes in the stool and the urine. Certain medication may cause taste changes. So when the patient is aware only, they will not feel panic. And also it is important to explain to the patient when we are administering the sedatives, it will make them to feel giddy or drowsy. So when they need to move out of the bed, they have to get the help. Alone they should not make attempt to go to restrooms because they are at risk for fall. The 10th one is right to refuse. Do remember the patient is having the right to refuse the medication. In that situation, remember the RRCR. Number 1, reassure the patient, don't pressurize them, don't compel them to take the medicine. Explain them in the pleasant manner that what for they are taking that medicine. If they are not taking, what will happen. Still they are continuing to refuse it, report it to the senior staff and also to the doctors. They may help you to make the patient to understand and take the medicine. If the patient is continuing to refuse, then continue the monitoring of the patient. For an example, if the patient is diabetic and refuse to take insulin injection, monitor the blood sugar level. If the patient is hypertensive and refuse to take the hypertensive medication, monitor the blood pressure, and with the time record it in the patient care sheet. We all are human beings, so errors may happen. but medication errors are highly avoidable, highly preventable. When we follow the 10 rights of medication administration, the medication errors can be avoided. In this video, we have learned about the 10 rights of medication administration, because the medication errors are preventable when we follow the 10 rights and ensure the patient safety. The 10 rights are divided into two, that is basic 5 rights and additional 5 rights. That is, basic 5 rights are right patient, right drug, right time, right dose and right route. The additional 5 rights are right documentation, right assessment, right evaluation, right patient education and right to refuse. Always remember, the basic 5 rights are highly important to prevent the medication errors. In the modern world, there is lot of digital technologies are there to ensure the safe medication administration. Along with that, when we follow the 10 rights, definitely we can avoid the medication errors. Let your patient be safe in your hands. For this, I have referred the fundamentals of nursing textbooks and also from the internet. Thank you for watching.